The American Heart Association supports fighting heart disease and stroke by funding core scientific research. Recently, the regional AHA Board of Directors stopped by LSU Health Shreveport for an impact tour to learn about cardiovascular research occurring on campus.
We have 23 basic scientists, 15 clinician scientists that make up the Center for Cardiovascular Diseases and Sciences. And we study various aspects of cardiovascular disease, heart disease, stroke, neurovascular disease. And our faculty have been very successful over the last several years in obtaining extramural grant funding, both from the American Heart Association as well as funding from the National Institute of Health. Of the money that we have currently coming to LSU, that $14.8 million, around 60% of that, right? Around 60% is directed toward cardiovascular disease research.
The group also met with young researchers who have been funded by AHA grants.
So we had to develop a mouse model where our protein was deleted in macrophages, and then we looked at plaque development in those mice compared to regular wild-type mice, and we were able to show that atherosclerosis is decreased when we remove this protein. So lipin-1 is clearly doing something that enhances atherosclerosis through its activity in macrophages.
So we in this lab study angiogenesis, and that's the development of new blood vessels. We're actually finding that our immune system that typically comes in and kills toxins that come into the body and everything are playing a big role, and glutathione may be regulating that. It's pretty neat stuff, and that's kind of what I was funded to look at first, and we've gone on from there, and now we've got some R01 funding from the NIH, which are bigger grants kind of to help develop some of these ideas and maybe take them to clinic one day.
So the AHA has really given me all the tools that I need to go ahead and publish these findings. So not only do they pay my stipend, which allows me to work here while my boss can spend a little bit of extra money on lab supplies instead of paying for me. It shows that I can communicate my science and that people understand what I'm trying to do and that they felt I was worthy of the funding that I was given.